So greetings everyone, this is Bhealthy and we are the 10 years RCOG annual scientific conference, and we are very much pressured and honored to welcome the FIGO President, Professor Anne KIHARA. You are very most welcome.
Thank you so much.
Our
I'm happy to be here.
Yeah.
Yeah.
So how has been the experience of being here in Rwanda, specifically to this time?
RSOG, or the Rwandan Society of Obstetricians and Gynecologists, are celebrating a decade. I was here in the formative years, so I have actually seen their growth.
Yeah.
And what is exciting most is it's the first time I'm coming for the actual Congress,
Wow.
but I have been online.
Yeah.
But what is amazing me particularly about this visit is I've been able to interact with colleagues, interact with students.
Sure.
I've been able to visit your fantastic Center of Excellence in Minimal Invasive Surgery.
The
and
ARICAD?
even, yes.
Wow.
And even gone to the Rwandan Society office.
Wow.
Now, those are milestones.
Wow.
As if that's not enough, we've had scientific sharing that has gone on, particularly from the indigenous Rwandese colleagues, from Congo, from Africa,
Yeah.
from global.
Sure.
So I think the sharing that has happened of evidence-based practices has even given us room to rethink. How can we actually make this a more productive, a strengthened approach in which people can share in this practice and discipline?
Yeah.
The last thing that really has touched me most, particularly about this Congress, is to actually see having fellows that are coming up.
Wow.
So we have fellowship in oncology, we have fellowship in maternal fetal medicine, and we have fellows who have actually completed minimal invasive surgery.
Sure.
I think in the current world, it's not enough to just be a basic general gynecologist, but to really specialize all the more, to be able to have centers of excellence, hopefully providing quality care that women so deserve.
Wow. Wow.
Yes.
That's awesome.
Yeah.
What's the FIGO doing to help these local associations like the RSOG to do better of what they should be doing?
Okay, so we've had the science.
Yes.
So we have been sharing evidence-based practices. But I must say I've just walked out of a meeting before their AGM. At 10 years, I have asked them the question, 10 years, so what? That's the question I've just posed to them.
Yeah.
And I have said, as you grow, how do we continue the momentum of accelerating our growth?
Yes.
The second thing beyond the momentum is, what do we prioritize as areas that we must focus on to reduce women's morbidity and mortality in Rwanda? The other thing is the context within the global village. Are we generating practitioners fit for purpose? We have geopolitical mayhems globally. We have socioeconomic recessions. We have climate change. We have food insecurity. We have malnutrition. And we need to articulate not just dealing with a woman's health
Sure.
in reproduction,
Sure.
but their sexual health and also the rights for women.
Wow.
The other thing is, I have looked, as FIGO, we have 139 member societies drawn globally.
Wow.
Rwanda is one of them.
Wow.
So how can we twin regionally in Africa, also get into South-South collaboration, and globally, even to have better lessons learning? We shouldn't think of taking baby steps, but how can we be catalytic? And this, I really see it through the resident program training.
Yes.
I see it through experts coming in and sharing their expertise on a voluntary basis, because those who work in FIGO are principally on volunteer basis. We have 22 scientific committees which address different subdisciplines within obstetrics and gynecology. So how do we draw from that evidence that is generated, from the guidelines being generated, from the policy environment, from implementation research? How do we get into co-granting?
Sure.
Even as member societies, and particularly knowing the need is most, particularly being African, in sub-Saharan Africa. And then advocacy.
Sure.
How do I advocate for women's health at the level of the Ministry of Health, At the level of your RBC, I am pleased. This whole week I've been working and sitting together with them and even challenging them and challenging myself with academic personnel and researchers, with people from the global public health. And then having even visited hospitals, it then becomes realistic for me to actually know where is the need needed and what can we do together as a collective.
Sure.
So I'm really pushing that agenda, even as I had this meeting with them just before their AGM.
Wow.
Yes.
Professor, at the opening of this conference, as part of your remarks, you say that about this mobility and mortality, it shouldn't only be at 70%, it should be reduced to 0%.
Yes.
Is that possible?
I believe it is. Why do I say I believe it is? In the high-income countries, they're in less than 10 per 100,000 of live births.
Sure.
Less than 10.
Wow.
What makes you think
we
cannot get to where they are? Number two, I have a constant motto. Who should die? No woman. No woman. So it means we're articulating zero rate any woman from dying during pregnancy and childbirth.
Wow.
That is the dream that should be made a reality. And it speaks to a lot of things. Number one, identifying what is killing them within your context.
Yes.
Number two, and this requires you to monitor the data and to actually interrogate the monitoring and evaluation of that data. Number two is to really address the health system to support providing of rights-based care, quality care, efficient care, and coverage. Every woman, irregardless of which part of Rwanda she stays within these 1,000 hills, must be reached. What we say, try, aspire to reach the last mile. And where you can't reach it, use innovations to help us get better outcomes.
Wow. Wow.
Yeah.
As a conclusion, what should be the take-home message to the people, especially the gynecologists and everyone who attend this conference?
I want to start by saying, Rwanda, you're doing well. When I look at the maternal morbidity, mortality, neonatal morbidity and mortality, your statistics are coming down, and progressively so. But we haven't reached the target for SDG. We have less than 6 years to go. We need to look at ways of accelerating that progress. And it takes you, it takes me to pull together to actually make that a reality. Number two, we shouldn't lose sight. We are the pinnacle doctors in women's health. And when I say women's health, even women's reproduction, we are responsible for the citizenry being produced in Rwanda for tomorrow. So we need to be very, very intense in making sure you give the best you have so that we have healthier outcomes for both the mother and the baby. We must have a healthy nation so that we can also generate wealth and development of Rwanda.
Wow. Thank you so much for your time.
You're welcome.
Thank you.